Hi, I'm Dr. Marty Willmitch. I'm a board-certified chiropractic neurologist practicing here in Tampa, Florida. I've been in private practice in Florida since 1999. And I want to talk to you just briefly today about weight loss and some weight loss strategies that we have at our office. Now, when I talk about weight loss, I'm not talking about dieting. The reason you're watching this video right now is you've probably spent a large part of your life dieting. And what's that gotten you? You may have lost a little bit of weight. You may have put weight back on. Typically, you're going to lose some weight, but you're going to put more weight back on than you actually lost. Okay, and that goes for the medical weight loss plans out there right now. HCG, human chorionic gonadotropin, some of the appetite suppressant medications. It's pretty big business right now, and I'm here today to talk to you about true scientific weight loss. Everything that I'm going to talk to you about today is based in science, okay? It's not fad dieting. It's based in science, based on laboratory testing. It's not chiropractic philosophy. It's not medical philosophy. It's true science, okay? So that's what we're going to be talking about today. Now, I want to apologize real quick. Number one, I'm not a professional speaker. I do not get paid to speak, so I apologize about the quality. I am very, very sorry. I'm actually a practicing doctor. I'm putting this video together today to give you the information that you need, okay? A lot of the weight loss information out there that's being pumped down our throats right now these days is absolutely false. Not only is it false, it's not going to get you to your ultimate goal, but it's actually dangerous, okay? So I want to talk to you today about the true scientific research that backs what we do as far as weight loss in our office. Now, a lot of you are probably saying or asking yourself, what's a chiropractor going to tell me or talk to me about weight loss? Well, we treat a lot of disorders in my office, not just necks and backs and disc problems and sciatica. We still treat a lot of that. I have a very busy practice. We treat a lot of that. But we also treat other health disorders, chronic health disorders like fibromyalgia, migraine headaches, inflammatory bowel diseases, peripheral neuropathy, different types of neurological conditions. In doing that, we have to figure out what's causing the problem. And a lot of times, the cause of the problems are resulting in some of these patients to gain a lot of weight. So by treating them naturally, getting to the root cause of their problems, their underlying health problems like fibro or migraines or whatever, these people lose a tremendous amount of inches as well as a tremendous amount of weight. Okay? Sometimes 30, 40, 50, 60, 70, 80 pounds. Okay, over the course of a few months. So what I'm doing is I'm providing information on true scientific weight loss, okay, in this video. So again, I apologize about the quality. It's really not about how good the video is and how well I talk, because I don't talk very well at all. I hate public speaking. I'm putting this information out there to dispel a lot of the myths and a lot of the lies that are being, told right now about weight loss, okay? So with that being said, let's get started. Okay, I want to talk about just some of the facts on weight loss and weight gain and chronic obesity. Okay, number one, it's epidemic in this country. It is exploding in this country. Over 65% of Americans are obese. Okay, obesity packs many, many, many negative health benefits or negative health effects. Okay, number one is an increased risk of heart disease. Okay, increased risk of cardiovascular disease. You have an increased risk of type 2 diabetes. There's an increased risk of hypertension or high blood pressure. There's an increased risk of certain cancers. You have decreased sexual activity or sexual function. You get a decrease in quality of life and longevity. There's decreased energy, sleep problems, a decrease in your self-esteem and self-confidence, which can sometimes lead to depression and anxiety and other mental types of disorders. And you also get or see a rapid deterioration of the spine and spinal tissues, okay, which leads to dysfunction, which leads to a more sedentary lifestyle and more weight gain. Excuse me. So in order to understand weight and weight loss and weight gain, you got to understand that carrying extra weight inside your body, these types of things are happening right now as we speak, okay? I know some people don't want to think that, but unfortunately it's the truth, okay? If you're carrying extra weight right now, these processes that I talked about are either there or they're in the process of becoming apparent. Okay? The most dangerous thought that you can have right now is that this stuff won't happen to me. Okay? It will. I promise you. It may not be tomorrow or the next day or next week, but eventually this stuff is going to catch up to you and it is going to hit you like a ton of bricks. Okay? Right now is the time to decide what you want to do for the rest of your life. Okay? What you want the rest of your life to look like, to be like. Okay? How do you see yourself down the road? What do you want out of the future of your life? Okay? Right now is the time that you need to think about that. All right? If your BMI, your body mass index, isn't where it needs to be, okay, I sincerely hope that you're going to make a decision to take action that's going to change your life for the better. Okay? Your BMI, your body mass index, is a pretty good indicator of your health. Okay? Body mass index is calculated by a certain formula. I'll tell you what it is right now. In order to calculate your BMI, you have to take your weight in pounds and divide that by your height in inches multiplied by your height in inches. Okay? Take that number and multiply it by 703. That's going to give you your BMI, your body mass index. Again, take your weight in pounds, divide it by your height in inches multiplied by your height in inches. Take that number, multiply it by 703. That's what your BMI is, your body mass index. There's 4 BMI categories, 4 body mass index categories. Underweight is a number that's under 18.5. Normal weight is anything from 18.5 to 24.9. Overweight is 25 to 29.9. And obese is any number equal to or greater than 30. And again, like I said, excuse me, 65% of the population in America is obese. Okay? That is huge. No wonder why we have the problems that we do from a health standpoint. Diabetes and heart attacks and strokes. It's rampant. Okay? So again, underweight is anything under 18.5. Normal weight is 18.5 to 24.9. Overweight is 25 to 29.9. And obese is any number equal to or greater than 30. Okay? Again, the calculation for your BMI is you take your body weight in pounds, divide it by your height in inches, multiplied by your height in inches. You take that number, you multiply it by 703, and that's going to give you your BMI. So let's talk about weight and weight gain and why it's not just calories in versus calories out. What we've been told from the time we were young. Okay? You got to understand that weight gain is more than calories in and calories out. That is a falsehood. Okay? It doesn't happen that way. And if you don't believe me, just think for a second. How many skinny people do you know or do you see that can eat anything that they want, any time that they want, and they never gain weight without exercising? Okay? They don't exercise, they eat whatever they want, whenever they want, and they don't gain weight. Then compare that to the number of people that are overweight, that basically starve themselves. Okay? They eat very, very little, if anything, and they exercise all the time, and they never lose any weight. Okay? If it were as simple as calories in versus calories out, that wouldn't be the case. And believe me, when you stop and think about it, it's not just a few people here and there that fall into that category. It's a huge number. Okay? More towards the obese side, more people are starving themselves and working out and killing themselves, and they're never losing weight. Okay? So that's what this talk is all about. Why weight loss and weight gain is more than just calories in and calories out. So why does weight gain occur? Well, it's actually pretty simple. It happens because something is going on inside the body that's altering the body's metabolic function or your metabolism. Okay? Again, weight gain occurs because something is happening inside the body that's altering the body's basic metabolic functions. It's altering your body's metabolism. When you alter your metabolism, you cannot burn the calories that you're putting into your body off as energy. Okay? So what is it that alters your body's metabolism? It's pretty simple. It's inflammation. Okay? Inflammation is going to screw up your body's basic metabolic functioning. Inflammation does several things inside the body from a metabolic standpoint. Inflammation causes an imbalance between your fat burning and your fat storing hormones. Okay? Fat burning hormones are growth hormone, insulin-like growth hormone, glucagon, adrenaline, thyroid hormones, both T4 and the more active version T3, and testosterone. Fat storing hormones are things like insulin, estrogen, and the biggie cortisol. Okay? We've all heard about cortisol. You've seen the TV commercials. Okay? Cortisol goes up and it creates belly fat and blah, 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 blah. You take a pill, you get rid of cortisol, and you lose weight. Okay? That's a lie. All right? Cortisol is your body's main stress hormone. Anything that activates the physiologic stress in your body, your cortisol levels are going to go up because your adrenal glands get triggered into dumping cortisol to deal with the physiological stress. What cortisol actually does in your body is it raises levels of glucose. The more glucose in your body, or as glucose levels go up and your body is not able to utilize it properly, that glucose gets stored as triglycerides, which gets stored as cholesterol, which gets stored as fat. Okay? You cannot take a pill to lower cortisol levels. I'm sorry to say that. All right? If it were that easy, everybody would be skinny. Okay? We wouldn't have 65% of our population being obese. All right? There is no magic pill for weight loss. Okay? Again, let me say that again. There is no magic pill that's going to result in weight loss. Okay? Unfortunately, it's just not the case. All right. So, like I said, what causes inflammation? Excuse me. What causes inflammation in the body? Or what does inflammation cause in the body? It causes an imbalance between your fat burning and your fat storing hormones. Inflammation also causes decoupling of the mitochondria inside the cells of your body. The mitochondria are your body's power plants. Okay? They're inside each and every single cell inside your body. And the mitochondria basically combine glucose that we get from our diet with oxygen, the air that we breathe, runs it through an enzymatic process that uses nutritional elements, certain nutritional cofactors, and it burns off the glucose and oxygen into making ATP, which is the body's usable form of energy. Okay? As inflammation goes up, it causes those mitochondria to break down. You can no longer combine glucose and oxygen, burn it off, and derive ATP or energy. So what happens is your glucose levels begin to go up. Okay? Again, glucose gets stored away as triglycerides, then cholesterol, then fat. Okay? So the more glucose we get, the more adipose or fat tissue we get. So again, you decouple the mitochondria, you're going to see increase in glucose, a decrease in energy, and a resultant increase in fat. All right? Now, inflammation is swelling. Okay? Inflammation is swelling, water retention. Okay? If you retain water, what happens? We start to get bigger. We get bloating. We see swelling around the abdomen and peripheral tissue. We swell. The more water we retain, the heavier we get, the bigger we get. Okay? Inflammation also affects the central nervous system. Okay? Inflammation is going to most commonly affect not only the body's metabolic functioning, but it also affects the brain, the central nervous system. What happens when we inflame the brain? We get fatigue. We get decreased energy. We get depression. We get anxiety. We get a lack of drive to get up and do. And if we're not getting up and doing, we're getting into that sedentary lifestyle, we're going to start to put weight on at a very accelerated rate. So again, inflammation of the brain is going to cause problems, okay, from a metabolic standpoint. So now that we know what inflammation does, let's talk a little bit about what causes inflammation in the body. Inflammation comes from anything that activates the normal immune response in our body. Okay? I put a chart together. I'm going to talk about it. And you're going to understand it very, very well. Okay? Because this is ultimately what weight loss comes down to. Okay? Again, inflammation comes from anything that activates the immune response inside the body. So, let's say, for example, your immune system is made up of immune cells, your white blood cells. Okay? You get a bacteria, or you get a parasite, or you get a virus, or you get something inside your body that triggers that white blood cell. That white blood cell is going to release a chemical, a compound. It's a protein. It's called a cytokine. Excuse me. Cytokines are the chemical messengers of the immune system that control and coordinate the immune response in the body. Cytokines, over a long period of time, are pro-inflammatory, meaning they will cause an elevation in the level of inflammation in the body. It causes inflammation. Okay? So typically when we get a cold or we get a flu, the immune system kicks in. It kills off that infection over the course of 5 to 10 days. The cytokine levels come down. We start to feel better. No big deal. Okay? However, if we have something inside of our bodies that triggers that immune system and activates that immune system day after day after day, after weeks, after months, after years and decades, okay? Those cytokine levels grow and build and gather and accumulate, and they stay persistently high, which causes an ever-increasing elevation of inflammation in the body. This prolonged elevation of inflammation in the body is what causes the damage. It alters the body's metabolic functioning. It causes an imbalance between fat burning and fat storing hormones. It causes decoupling of the mitochondria. It causes swelling to occur in tissues in the abdomen. We start to bloat and get bigger. It causes or affects problems with the central nervous system, which leads to sedentary lifestyles. It causes a lot of things to happen. Okay? So again, what is it that causes inflammation in the body? It's anything that can activate the immune response inside the human body. And that's what this is all about, this chart. And I apologize, you may not be able to see it, but I'm going to explain it, okay? There are certain things that we know through scientific research that will trigger an immune response or activate the immune cells inside the human body, okay? So what are some of those things? Infections, like I talked about. Okay, and I'm not talking about the colds and the flus and that, that kind of stuff that go away in a week or so. I'm talking about persistent infections. Okay, these primarily happen in the gastrointestinal tract. Okay, you've all probably seen the Discovery Channel about the bugs inside me or the parasites inside me. Some people will pick up a parasite, which is an infection, and it can be there for years and decades. Okay. Sometimes we have dysbiosis, or an alteration of good versus bad bacteria that normally live in our guts. Typically, we all have about 3.5 pounds of beneficial bacteria that live in our gastrointestinal tissues, which helps us to digest food. It synthesizes certain nutritional elements that we don't get from food. So we can alter the count between good and bad bacteria, and it can create abnormal excitation of the immune system. Okay? There's other things like viruses or molds, yeast, and funguses. Okay? So anything that persists in the body from an infectious standpoint over a long period of time can raise levels of inflammation in the body. Now you have other things like toxins, okay? Environmental chemicals. Everything that we eat, everything that we buy in a grocery store at the farmers markets, unless it's organic, is sprayed with chemicals. Pesticides, herbicides, fungicides, fertilizers, okay? We have to, okay? Our food suppliers have to do that in order to grow enough food to feed all of us in this country and across the world for that matter. But these chemicals can accumulate in our bodies over long periods of time, and those can start to trigger immune responses in the body, which can cause inflammation, which can make us sick. All right? There are other environmental chemicals or toxins, things like heavy metals. We all know that heavy metals like mercury and lead cause problems in the human body, very, very serious health problems. But it can also cause low levels of inflammation or lower or less harmful health problems in the body by increasing levels of inflammation by activating the immune response. And again, it's that inflammation that makes us gain weight. There's other things too. Food sensitivities, okay? 80% of the population in this country has food sensitivities. I hate to say it, and a lot of you probably are shunning or rolling your eyeballs, not believing what I'm saying. But if you don't believe me, get online. Go on PubMed, the National Library of Medicine. Get on PubMed, get on these websites, and look at the scientific research out there. Okay? It's there. Okay? Food sensitivities are very real, unfortunately. They're very scary because they're so common, but they are also very, very real. All right? Our immune systems are controlled by our genetics. Our genes make us who we are and what we are. Our genes also tell our immune systems what's friend and what's foe. Okay? If you are genetically sensitive to something, okay, a particular compound, if you put that compound into your body, your immune system is going to react to that compound. It is going to attack it, activating the immune response, increasing levels of cytokines, which increases levels of inflammation over time. If you're genetically resistant to those things, or that compound, your immune system looks at it and says, no big deal, move on. All right, nothing happens, no inflammation, because no cytokines, because there's no response. All right, the simplest thing I can do, or the simplest explanation or example I can give you is smoking. Think about, and I'm not going to chastise anybody for smoking, okay? That's not what this is about. Think about people that have smoked. All right, we all know smokers, okay? Again, I'm not saying anything good or bad, okay? I have an uncle, or had an uncle, okay, who smoked for over 80 years. He died of natural causes in his sleep. He smoked 2 packs of non-filtered Pall Mall cigarettes a day. All right, my Uncle Mikey died in his sleep, natural causes. I have another relative, or I have several relatives that died of lung cancer and never smoked. They hung around with smokers, but they never smoked themselves, and they died very quickly, in their 40s and 50s and 60s. All right, why does that happen? Well, some people are genetically resistant. My Uncle Mikey, he was resistant, genetically speaking, to the chemicals and compounds in the smoke that he was breathing in or inhaling. And other people are genetically sensitive to those compounds. When you're sensitive, your immune system reacts. When your immune system reacts, you release cytokines. Cytokines cause increased levels of inflammation over time. Not only can that inflammation cause alteration in the body metabolism, but it can also alter your cell's DNA. If you alter the cell's DNA, you're going to start to develop atypical cells. They start to clump together, it forms tumors, and we have cancer. It's been proven and shown time and time and time again in research, in scientific research, that chronic inflammation is the root cause of all chronic health problems in the world. Obesity is one of the biggest health problems that we have right now. Okay? So again, food sensitivities, and 80% of the population do have genetic food sensitivities. Other things that can activate the immune response or create inflammation in the body are emotional stress. There's certain medications that can damage tissue, which promotes more inflammation in the body. Those are things like NSAIDs, non-steroidal anti-inflammatory drugs, the over-the-counter pain relievers, aspirin, Tylenol, Advil, Aleve. Okay? They cause problems in tissue, the gut primarily, the gastrointestinal tissue, which promotes more inflammation, which makes us sicker. You can have a compromised detoxification system in the body. The more these toxins build up, the more activation in the immune response, the more cytokines, the more inflammation. Our bodies have built-in detoxification systems and pathways. If we burden them too much, if we damage them, if we have nutritional deficiencies, those detox pathways can't work optimally, and we start to see accumulation of these toxins and different things that activate the immune response, create cytokines, which creates inflammation, which makes us larger. Okay, we gain weight. Okay, also, like I said, nutritional deficiencies. If you're deficient in certain nutrients that are necessary to run these detox pathways, or to allow the combination of glucose and oxygen to get burned off as ATP, you're going to have increased levels of weight gain, okay, because of increased levels of inflammation. So how do you know which one of these things or which ones of these things are present in your body? You've got to do testing, okay? Think of it like this. If the lights go off in my office, okay, how do I know where the problem is? It could be a problem with the light bulb. It can be a problem with the soffits or the electrical outlets. It could be a problem with the wiring. It could be a problem with our breaker box. It could be a problem with the transformer or the wires outside, okay, the power lines leading to my office. It could be a problem with the power station, okay, the power plant. We don't know where the problem is at until we figure it out, and you figure it out with testing, okay? Same thing when it comes to weight gain and weight loss and inflammation in the body. How do we know which one of these things or which ones are present in your body? We just don't know. Nobody, I don't care how smart they think they are, can look at you, look in the eye, and tell you which of these things are present. You've got to get tested. You've got to do testing. There are certain labs out there that can test for each of these things. Okay? When you find them inside the body, as long as they remain present, you are going to be unhealthy. You're going to have increased levels of cytokines, increased levels of activation of the immune system, increased levels of inflammation. The more inflammation, the more unhealthy you are. The more unhealthy you are, the more you're going to gain weight. So the goal of this weight loss program is to get you healthy, to figure out what's making you sick. You get those out and you allow the immune responses to come back down, cytokine levels come down, inflammation comes down, you get healthy again and you start to lose weight. I have news for you. Unhealthy people cannot lose weight. It's impossible because your body is not healthy enough to burn off that fuel. Okay? It gets stored as fat. So getting you to a comfortable weight level has to do with getting you healthy again. All right. So again, let me just kind of go over this really quick. This is called the toxic body burden. Infections, heavy metals, chemicals, food sensitivities, and certain medications, decreased levels of nutrients, leaky gut syndrome, decreased detoxification pathways in the body, hormone imbalances, and emotional stresses. It activates the immune response. When you activate the immune response, you're going to get a release of cytokines. And when it happens over time, it's going to create not only localized inflammation and swelling around the abdomen, but it's going to create increased levels of systemic inflammation elsewhere in the body. Okay? So you get swelling of the peripheral tissues. You get decoupling of the mitochondria. You get an imbalance between fat burning and fat storing hormones. You get inflammation of the brain, which results in sedentary lifestyles, depression, which leads to more weight gain. So this problem just kind of spirals downhill or spirals out of control. Increased levels of systemic inflammation are going to cause symptomatology, everything that I'm talking about. Okay? So the trick to fixing you is to figure out exactly what's causing this problem of inflammation in your body. Again, the only way you can do that is to do testing to figure out exactly what's there. Once you figure out what's there, then you can safely begin the process of removing those trigger mechanisms. Okay? If there's metals, you get rid of them. If there's infections, you kill them off, you get rid of them. If there's food sensitivities that are there, you don't eat the food anymore. Okay? If there's decreased nutrients, you put the nutrients back in. You work on digestion so you can actually start to absorb those nutrients once again. Again, it all comes down to what's there in your body, what's causing the problem. Each of these problems can be dealt with differently, okay, in combinations with different people. No one's the same, okay? Our bodies are too complex for everything to be treated with one pill, okay? That's why it doesn't work. You got to do some investigative work to figure out exactly what's there. So, speaking of that, how do you fix these problems? Well, number one, you've got to stop this underlying inflammatory mechanism by identifying what's actually triggering the immune response, which is causing the inflammation. That's number one. You cannot lose weight, you cannot get healthy, you cannot heal until you stop this destructive mechanism and process. Think of it this way, if I go home tonight and grab a fork and start scratching my arm, eventually I'm going to do so much irritation, so much damage, my skin's going to start to break down, I'm going to start to bleed. If I want that lesion to heal, what's the very, very first thing that I need to do? Before I put any Neosporin or any bandages on it, I've got to stop irritating that tissue. I've got to stop scratching it with the fork. If I never stop this, it's never going to heal. Ever. No matter how much medication I put on it. You stop the irritation. You allow the body to start the healing process and you provide extra care and extra nutrients to help it heal quicker. Okay? That's what Neosporin and bandages do. Okay? It just helps the body heal quicker, but you can't heal it until you stop that scratching, stop that irritation, stop the inflammation that's causing the damage to begin with. All right? So, once we do that, we look at your body from both a metabolic standpoint as well as a neurological standpoint, because remember, the inflammation is not only going to screw up your body's metabolism, but it's also going to screw up your body's neurologic system as well. If it screws up the central nervous system, you're going to have problems with fatigue, decreased energy, sleep problems, decreased motivation. That happens because certain centers in the brain, excuse me, are becoming inflamed from all that inflammation that's coming from the abnormal immune response in the body. When you inflame a tissue over time, that tissue is going to break down and dysfunction. If the centers in your brain that control sleep or energy levels or motivation are damaged because of inflammation, they're not just going to heal. They need to be rehabilitated. We can do that through neurological rehabilitation through a process of what's called neuroplasticity. Again, it's articles written in Time magazine and it's on 60 Minutes. It's why stroke patients heal. It's why stroke patients can resume function again. Okay? Anyways, it's a little bit off topic, but again, we treat people both metabolically and neurologically. The metabolic stuff has to do with testing, okay? Getting back nutrients into the body, nutritional supplements, dietary planning, dietary modification based upon lab testing, okay? I don't want you to think of my program as a diet. It's not, okay? It's not a diet. Diets don't work, okay? Diets are frustrating, okay? This program is about restoring health, okay? Showing you and teaching you through laboratory testing what promotes optimal health, okay? Through dietary measures, through nutritional measures, okay? That's what this program's all about. It's based on science, okay, not fad, all right? So once we begin the metabolic correction, the metabolic healing inside the body, we can also rehabilitate the neurological components in your brain that are being affected by the inflammation. We do that through, like I said, neurologic rehab. Think of a nerve just like a muscle. If you have a muscle that gets damaged, it's going to get weak. The weaker it gets, the more abnormal it's going to function. You don't just stop using that muscle. What you do is you rehab it. You force it to move. You exercise it. Every time you move it, it fires. Every time it fires, it gets stronger. The stronger that muscle gets, the more normal it's going to function, and nerves work the same way. Inflamed nerves begin to dysfunction, okay? In order to start normal function again, you've got to stimulate that nerve. Every time it gets stimulated, it fires. Every time it fires, it gets stronger through a process of what's called neuroplasticity. Generate new nerve endings that strengthen the bond or bridges between different neurons. Okay. Over time, we can re-strengthen these neurologic centers that have been damaged because of increased levels of inflammation in the body. As they heal and recover and rehabilitate, you get better function. Okay? And I got news for you. You've got to get up. You've got to get moving. You've got to, weight loss begins because of weight gain begins because of inflammation. But it's perpetuated because of not only inflammation, but also sedentary lifestyles. So we can correct the metabolic stuff going on in the body, and we're going to start to see weight loss. But in order to continue that weight loss, in order to maintain that level of weight loss, you need to get up and start moving. Okay? The more muscle we have on our bodies, the more we're going to actively burn glucose off as energy. Okay? That's why exercise is one of the best cures for depression. It's one of the best cures for chronic fatigue syndrome. Okay? But you got to get the person healthy enough to be able to do that. All right? So that's the basics. That's the gist of what this program is all about. So what's next? Okay? Well, what's next is, if this makes sense to you, and I hope it does, because like I said before, it's all based on scientific evidence, scientific fact. Okay? If you don't believe me, get online and do a little bit of research. Spend an hour or so. It's there. Okay? If this information makes sense to you, and if you're sick and tired of dealing with, the weight loss and the weight gain and the weight loss and the weight gain and never getting anywhere with these fad diets and this lie of calories in versus calories out, then give us a call, okay? My office number is 813-933-6481. Again, it's Dr. Marty Willmitch. My office number is 813-933-6481. Call my office. One of my staff members will schedule a consultation for you with me. Okay? That consultation is done over 2 days. Okay? Because this is a very detailed process. On day one, what I need you to do is bring in all of any information that you've got. Okay? Your history, we're going to talk about it. We're going to go over what you've done in the past and what's worked, what's not worked, what were the benefits, what were the the gains that you made, how long did they last. We're going to talk about all that stuff. I also want you to bring in blood work. Okay? Get in touch with your family doctor or any of the doctors that you've seen in the last 6 to 12 months. Get copies of your lab results and bring that with you. Okay? I need to see that. Remember, weight loss isn't about calories in and calories out. It's about underlying dysfunction in the body, and we can use some of that blood work, those lab results that you get, to try and formulate a plan as to which one of these things or things can be present in your body. So we're going to look at your blood work, and we're going to let you go. All right? When you come back the next time, okay, for your second appointment, what I'm going to need you to do is bring your spouse or a loved one or a friend, somebody that you trust, because I'm going to go over a lot of information, okay? And you're going to need an extra set of ears, okay? So I want you to bring somebody that you know and that you trust, so that there's an extra set of ears there, so that as I give this information, it's not going to go in one ear and out the other. I want you to get something out of this, all right? On that second appointment, we're going to tell you whether or not we can help you, okay? Whether or not I can take your case, all right? I have a very busy practice. I only take 8 to 10 patients like this a month, okay? So that gets me to my next point. If you're not sure, okay, or if you think I'm full of crap, okay, you just don't believe what I'm saying, don't call and schedule an appointment, okay? If you're just looking for more information, or if you're just exploring options, don't take a spot away from somebody that's really wanting to get in here and change their life for the better. Don't take that chance and opportunity away from somebody that truly wants to come in and start, okay? What you can do is input or enter your information, your name, your phone number, your information on the information blocks that are on this screen. What we'll do is we will continue to send information to you as we get new information from the research studies that are going on now. I will continually send information to you to help you make a better decision, okay? A better decision for you. Not for me or for anybody else, but a better decision for you. So again, if you're truly interested and you want to sit down with me and really explore this option to finally get this problem under control, call my office. The number is 813-933-6481. If you just want more information or you're not quite sure yet, enter your information on the information boxes on the screen. We'll continue to send new information to you as we get it, okay? The cost for the examination, the 2 visits, is normally $350. Because you've watched this video and you now kind of understand the basics behind real weight loss and real weight gain and why these things happen and what I need to do to help you get better, we're going to discount that fee from $350 to $65. All right? That $65 fee covers both visits, both day 1 and day 2. So if you're interested, now's the time. Okay? Now's the time you need to make a decision as to what you want the rest of your life to be like. Okay? Again, if you're interested, contact my office. My number is 813-933-6481. Our office hours are from Monday through Friday from 8 a.m. to 6 p.m. We're closed on the weekends, so if you're watching this over the weekend or after hours, you can call and leave a message on our machine. One of my staff members will contact you on the next business day, or you can call us during hours. Again, Monday through Friday, 8 a.m. to 6 p.m. One of my staff members will get you set up and scheduled to sit down with me for an initial consultation over the 2 days. We'll determine whether or not we can help you and what exactly I need to do from a doctor standpoint to help you reach your goals of health. So again, I want to thank you. I'm Dr. Marty Willmitch. My office number is 813-933-6481. I look forward to seeing you in the office.